Good morning, everyone. Just a disclaimer, I am not a physician. I am actually a PA. So just Lauren, but I'm also an exercise physiologist. And so I have a little bit of a unique perspective working with patients with diabetes on definitely a goal to get people physically active. So today we're going to talk about one of our initiatives to do that. So I don't need to go on and on about the benefits of diabetes with all of you experts in the room. I'll save my background slide for something different. So we all know the ADA standards of care. The goal is for every patient to be getting 60 minutes of moderate to vigorous aerobic physical activity every single day and at least 3 days per week of muscle and bone strengthening activity. But why did only 1 in 5 patients actually achieve that goal? And so this was a study I just wanted to highlight that was done in Quebec. And disclaimer, my presentation is not just on type 2 diabetes as well, just like Dr. Mann said. So this was done in Quebec. They surveyed 200 patients with type 1 diabetes for at least 3 months of duration. They asked their parents and the children with diabetes to rank some of these barriers. So you'll see 12 barriers were listed there, and they had them rank them from 1 to 7, with 1 being extremely unlikely to be a barrier to exercising and 7 being extremely likely. And you'll see that they differentiated by age category, so less than 12 and greater than or equal to 12. But in both, there's a common thread. Fear of hypoglycemia is a really significant barrier, especially for our patients with type 1 diabetes. And while we can't control work schedule or the fact that it's like 25 degrees outside here in Atlanta today, what we can do is provide better educational materials and support to help empower our families to live a physically active lifestyle and, overall improve their A1C, glycemic control, BMI, all the things. There also was an interesting finding here that greater parental support overall led to lower overall perceived barriers. So the rankings were overall much lower when their parents were encouraging or engaging in physical activity with them. And so this education doesn't just need to be provided to the patients themselves, but to the parents, because these are going to be the biggest determinants between our clinic visits when we're spending just a few minutes with them. So this is our team. I'm Lauren, and Millie Beccaria and Grace Kim are also here. You probably all know them very well. And we work together on the following SMART aim, which was to increase the percentage of youth within our clinic with both type 1 and type 2 that were being assessed and meeting goal of at least 10 to 30 minutes of moderate intensity physical exercise at least 3 days per week by 5% by the end of the fiscal year. And so these look really small on here. I'm sorry if it's hard to read, but we used a few QI tools to get started, one of which was a fishbone diagram. So on the left, we listed in black barriers to our patients meeting the ADA standards of care, and on the right in green, we listed possible interventions to overcome them. And so from a process point of view, we identified that our educational materials were kind of outdated. Now in the age of closed loop systems, we really needed to update some of those. From a patient and staff point of view, medical school, PA school, all the schools really give us the educational material to say, we should provide lifestyle modifications. You should get 60 minutes of exercise, but they don't really equip us with how exactly do we educate our patients and families on how to put that into place. And so we needed to provide education throughout the multidisciplinary team to help us feel more empowered to do that. From an equipment point of view, whatever interventions we made had to be equitable. Not everybody has access to technology, exercise facilities, equipment, and so we needed to keep that in mind. And last but not least, from a measurement point of view, we had no standardization of measurement. This was being measured by providers, dietitians, diabetes educators, and so we needed to streamline that process a little bit. So we took our fishbone diagram, placed some of the interventions onto a key driver, prioritized them on our effort impact matrix, and then implemented them through our rolling action item list. And I'll talk a little bit more about each of the PDSA cycles we use next. And so first and foremost, we had to get our documentation standardized so we could actually track our data. And so our dietitians and diabetes educators were already using something called goal documentation, and we wanted to just already use what was in place and not reinvent the wheel. So what we did is we added in a goal that said we'll accumulate 10 to 30 minutes of moderate intensity exercise at least 3 days per week. And at the assessment that the dietitian or the diabetes educator was already going in to do, they talked with them about this goal and were able to track, are they meeting this goal 50% of the time, less than 25%, et cetera. You'll see that on track is crossed out there. We previously just said they were on track or not, but we needed to kind of delineate that a little bit further. And then secondarily, in May of 2024, we educated our dietitians on the physiology of exercise and diabetes and provided some management strategies that would be practical and useful for them to use during their assessments. This is one of my most favorite things is that we actually integrated exercise prescriptions in June of 2024. So the American College of Sports Medicine is the accrediting body for exercise physiologists, and they have something called Exercise as Medicine. The idea behind this is that you would prescribe exercise just like you would prescribe a statin for hypercholesterolemia. And so this is broken down into aerobic and muscle strengthening exercise. So we use something called the FIT principle in exercise physiology, breaking down exercise into frequency, intensity, time, and type. The idea is that a provider will spend 1 to 2 minutes during their clinic visit discussing this with the patient. This is patient-led. They're the ones that are going to be expressing it. You're not going to just tell them, I prescribe you 20 minutes of bicycle. So they spend just a couple of minutes discussing with them. This is a smart phrase that is put into the after visit summary for those Epic users. And so this is printed out when they leave clinic. They have a physical copy, and this is something that can be followed up on at subsequent clinic visits for them to see how exactly are they doing meeting that goal. Another thing I'd like to highlight on the bottom is the what's your why. And so really we want to identify what exactly is that motivation for this patient. And this, again, is patient driven. So whether or not they want to improve their glycemic control, BMI, blood pressure, cholesterol, these are all things that they can discuss. And so we educated our providers on this initiative and asked them to start implementing this into their daily practice with especially type 2 patients, but overall any diabetes patients. In September 2024, we began doing some community outreach. And so on the bottom left, that was our 2024 booth. I also included our 2025 booth just for fun. And I think our costumes were a little bit more organized. We were all Astros players this year. So we do a diabetes bash every year at Texas Children's Hospital. It's a community gathering where we give out candy and have costumes and just gather people in the diabetes community. And so to kind of counteract that candy, we wanted to have a physical activity booth where what we do is we have the child engage in a fun activity such as like a jump and reach, a wall sit, doing some wall push-ups while we're discussing with the parents about some educational material. So we have handouts there available. We're there all with some clinical expertise, and we're answering questions and just providing them some guidance as needed. And we've had a really good success with that as well. In October 2024, we continue to educate members of our team. So our diabetes educators got some education on advanced exercise management strategies. This was especially surrounding closed loop pumps with all the different activity mode, exercise mode, et cetera. And then in November of 2024, we implemented patient-facing educational materials. So they're a little bit small, I apologize, but in the bottom left, this is our new AID and exercise handout. So it's stratified. The colors kind of delineate the intensity of the exercise. So we've got on the top left corner, aerobic light intensity for a minimal amount of time, so like less than 60 minutes, where you would have like a 25% mealtime bolus reduction or utilization of activity mode. And then the more intense or the more prolonged it gets, the strategies change just a little bit. And for the sake of time, I won't go into more detail. On the right, we implemented a full body workout in 10 minutes handout. So this was more geared towards our type 2 population, but for anybody who is looking to get started with exercise. It requires no equipment. It has a 1-minute warm up, a 1-minute cool down, and then 8 minutes of exercise from a circuit that you do twice. And so the patient can scan the QR code. It takes them to a playlist of all of the videos showing them how to do the exercise. Again, requires no equipment, very beginner level, and kind of addresses some of those barriers and gaps that some of our patients might be experiencing. And then in February 2025, we did a webinar with some of our families on how to manage diabetes and physical activity just to gain a wider audience and distributed these educational materials amongst them. And so here's our results. So you'll see our baseline was in Q4 of 2023, and we were able to assess 21 patients during that quarter. This is our baseline, and 38% of those patients were actually meeting our goal, which was 10 to 30 minutes of moderate intensity physical activity at least 3 days per week. By the end of Q2 in 2025, actually 73% of our patients, which 408 patients were assessed then, were meeting that goal. So not only did we get better at assessing, but actually more of our patients were meeting the goal too. So overall, we thought this was really successful, and we're excited about the next steps to come. That's all I've got. I'm happy to take any questions.
Hi, Jessica from Alabama. We recently stumbled on the goals in Epic, and we were all quite excited about that. Excuse me. In our prediabetes clinic, we've been using the goal setting and documenting the SMART goal. And what we've been doing is scheduling a message to the patient 2 weeks after the visit on the day of the visit pulling in the SMART goal that they documented and just saying, following up to check in on how you're doing. And so we've gotten some nice feedback for that between visit contact with literally one click from the provider because we saved it as a quick action. And so just something to consider if you're doing that. It's nice to have touch points with patients with no effort. Makes them.
I love that idea. Thank you for sharing that.
Hi, this is Emily from Cornell, New York. Also, don't say you're just a PA. That's phenomenal stuff.
Thank you.
Real quick, it'd be great to see if we could see more of the handouts you gave. And I just want to go back to the prescription you sent. So is that a true prescription or is it really just like a thing that you put in the after visit summary?
Yeah, it's not a real prescription. This is an after visit summary smart phrase, but it's meant to look like a prescription because it's kind of cute. And I think it just adds some gravity.
I think it made it like official, like, right? Like,
Yeah.
we talk about lifestyle modifications all the time, but then this makes it like, no, this is part of your plan. So I really liked it. Thanks.
Thank you.
Thanks, Lauren. This is Andrew from Cleveland Clinic Children's. Great presentation. I love the materials and actually would love to steal some if that's an option, both with the prescription as well as the exercise charts exactly. The question relating to those, for those of us that are in different parts of the country, you guys probably deal with 2 hot days. We deal with a lot of 2 cold days and really trying to figure out what activities can be done. Do you have a list of like tips or tricks or different things, especially from a virtual world standpoint, how we can get our kids up and moving? Thanks.
I do have a list of apps and YouTube channels that I would be happy to share. I have to just get permission to make sure that we can share these because they're branded, but I would be more than happy to share them. But yes, I like, just off the top of my head, Cosmic Kids Yoga is a great YouTube channel if you guys haven't heard of it. They have like all levels of activity that, you know, it's really easy to do, very engaging for the kids. I'll also say that for patients who are just looking to do something, I'll often tell them to put on like a virtual walk. And if you can't get outside to walk, you can walk inside your house and you can do walks through national parks. I mean, there's everything on YouTube. So just like a really easy, low-hanging fruit. Perfect. Okay.
It was a great presentation. I really enjoyed it. We're looking at exercise at our institution as well. But my question is, when you're putting it in goals, and I don't know how technical this is, but like, are you guys able to retrieve that information through like a data pool electronically from goals or not?
Yes.
Yeah, okay.
It's all done. We are not doing this manually.
Perfect.
Mhm.
Great. That's awesome.
Yeah, we recommend it. And I'll make a last plug if I finished a little bit early. What I would really ideally like to do, and I would encourage each of you to consider doing if you didn't have as much red tape as I do at a big institution, is to actually consider objective fitness assessments in your program. And so Angelina Bernier at the University of Florida has a great online resource where she talks about how to do this. And that's where I did some of my training. So I would really encourage it. It's our big picture goal. But if you have an institution where you can do that, it'd be great.
Are there any questions from online?
Not at this moment.
Okay.
But
Perfect.
we do have a question for Dr. Mann from your previous presentation that we weren't able to get to at the time from one of our Zoom attendees. So it's also from Trudy Murray. So did you break down by provider at all to see if some providers might have workflows that others could learn from if they were leading the visit order and organization for the day?
I love that question. And I think that's a great tool to use. And we definitely did do that. So there's a term for that I am blanking on, but where you break down data, basically like it's not a performance metric, but you break down data by provider and you present that provider with the data and then just in a curious way. So we definitely did do that. And there were a lot of trends we could find. So we did a lot of stratification of the data and just evaluating based on different to kind of develop our different ideas. So we definitely did do that. And we found we had some people sort of piloting going in first, and we found like the provider going in first, and we saw early success with that. So it really was kind of like, and I summarized this, it didn't put it in all the detail, but it was something we definitely started very small and then expanded the workflow.